Good afternoon, everyone. Welcome to our first or second Friday seminar series today. My name is Rob Murphy, and I'm the Executive Director here at the Institute for Global Health, and I'm Director of the Center for Communicable and Emerging Infectious Diseases, as well as the John Fair Professor of Infectious Diseases and Professor of Medicine and Biomedical Engineering. Thanks for joining us today. And our latest installment, our seminar series. It's today, the topic is the role of race, religion, and partisanship in misinformation about COVID-19. I think this is an incredibly timely topic. I hope you agree with me on that. This webinar is co-hosted by the Institute for Global Health and the Buffett Institute for Global Affairs and Northwestern University's Program in Global Health Studies. Please also, just to remind you, you can follow us on Facebook and Twitter at hashtag FSM Global Health. In addition, we welcome you to become an Institute for Global Health member to receive access to specialized resources and services that support the research infrastructure. For more information, please visit our website, which is very simple, globalhealth.northwestern.edu/members. Today, we're thrilled to have Professor James N. Druckman for the discussion of the growing concerns about misinformation among the public, particularly investigating misinformation about COVID-19 and the role of race, ethnic, religious, and partisan groups. Very timely topic. Jamie Druckman is the Payson S. Wild Professor of Political Science and Faculty Fellow at the Institute for Policy Research at Northwestern University. He's also an honorary professor of political science at the Aarhus University in Denmark. His research focuses on political preference formation and communication. His recent work examines how citizens make political, economic, and social decisions in various contexts, such as settings with multiple competing messages, online information, and deliberation. He also researches the relationship between citizens' preferences and public policy and how political elites make decisions under varying institutional conditions. Very timely. Druckman has published roughly 100 articles and book chapters in political science, communications, economic science, and psychology journals. And he has served as an editor of such journals as Political Psychology and Public Opinion Quarterly, as well as the University of Chicago Press Series in American Politics. He currently is the co-principal investigator of time-sharing experiments for the social sciences tests. There will be time for questions following the presentation, which we welcome you to submit through the Q&A feature at the bottom right-hand corner of your screen. And now, Professor Druckman. Jamie, I turn it over to you.
Yeah, thanks so much, Robert. I really appreciate you having me and everybody for joining today at the end of a very tiring and kind of stressful week. So as Robert said, the title of the project is The Role of Race, Religion, and Partisanship in Misinformation about COVID-19. And it's part of a project that's coming out of a large consortium with which I'm involved called the COVID States Team. And you can see the website for our projects there. And the goal of the project is that we've been collecting data since the start of March focused on COVID. And the interesting thing about our data collection, which will not be entirely evident from what I present today, but just to give you a little bit of background, is that we collect very large data sets such that we have large samples from every state in the country in DC on a continuous time series basis. We've done 14 such surveys. We've surveyed about 500,000 individuals over the last 9 months. And so we have data at a very granular level, both in terms of spatial, statewide, and in terms of time. And so we've done a whole bunch of things. We have many reports and papers if anybody's interested in that project on the website. And this paper comes out of one of those data collections. And so just a little bit of background in terms of that. So obviously this project, this particular paper is talking about misinformation and misperception. And I'll start just providing a little bit of brief history going back 100 years and to ask, does this sound familiar? And I'm obviously talking here about the Spanish flu 100 years ago and some news articles from there. Health Board gives warning of influenza danger, Spanish influenza, a new name for an old familiar disease. And so this is obviously something that's been going on for a very long time. In another newspaper article there. And there's a very fascinating article in Science, the journal Science, that was entitled Lessons from a Pandemic, that was published in 1919 by a sanitation engineer named George Soper. And in the article, he says, the most astonishing thing about the pandemic was the complete mystery which surrounded it. Nobody seemed to know what the disease was, where it came from, or how to stop it. Anxious minds are inquiring today. In spite of the repeated statement that some information has been discredited, there are many well-informed persons who believe it. So even if we go back to the Spanish flu 100 years ago, the idea of misinformation and misperceptions was certainly a salient concern. Obviously, when we fast forward to COVID-19 100 years later, this concern has become even more exacerbated given the information environment in which we live, which is a constant stream of information through social media, 24 hours news coverage, and so on and so forth. But still, the COVID-19 has some similarities. Just like the Spanish flu, it upended health, economic, and social systems. But as I just mentioned, the information environment is quite different in terms of the speed with which misinformation can spread, and that's quite unprecedented today. And so when we talk about misinformation, obviously it can have severe consequences in terms of people's own individual health and also the collective societal public health and actions taken by society, not only in terms of health, but also attributions that they make for responsibility for the disease and paths that they take in terms of public policy. So it's quite a salient concern to be exploring. In terms of contributions to work on COVID-19, there's obviously been a large number of explorations into COVID-19 misinformation. This became quite a cottage industry as soon as COVID-19 began. But nearly all of that work focuses on social media and misinformation spread. That is, how much misinformation are we seeing on social media? And that is actually something our project has done, and time permitting, I'll show you a little bit of that work at the end of this presentation, which is tangentially related to what I'll talk today. But the focus of what I talk today is on something else. We're going to use our data to focus on those individuals who are most likely to be misinformed or have misperceptions. So instead of talking about the role of social media in spreading misinformation, we're going to talk about what groups might be group level individuals might be most misinformed. And a motivation for doing that is that once we understand that, we might be able to develop targeted interventions for enhancing accurate information. And so where I'm going to go from here is I'm going to review very briefly some of the work on science misinformation in general to generate a few hypotheses about what we might expect when it comes to groups and misinformation. And by groups, I mean socio-demographic groups as well as partisan groups. I'll then talk about the data that we'll use to test these hypotheses. I'll go through the results and offer some conclusions. And then, as I mentioned, time permitting, I'll talk about some other work that we've done on Twitter and misinformation and how it relates to the work that I'll present today. So science misinformation is a particularly important form of misinformation. Of course, people study misinformation in all kinds of domains. And as a political scientist, which I am, political misinformation is obviously something of a very studied topic, particularly in light of the 2016 election. But science information holds a particularly problematic place insofar as science as an industry, as an endeavor, seeks to provide systematic knowledge to improve decision-making. Therefore, when people are misinformed about science, it can lead to, as I mentioned, disastrous individual decision-making and collective responses. So the question is, what group-level characteristics lead one to be more likely to believe misinformation? And by misinformation, we're going to use a definition that's very common in the misinformation literature, that is information that is false, misleading, or unsubstantiated, not supported by clear evidence or expert opinion. And again, these are crucial questions for interventions. So let me talk about the three group-level correlates that we're going to look at. The first is racial and ethnic affiliation. And if we look at the literature on scientific misinformation, what you see is study after study finding that racial and ethnic minorities have less confidence in science and are less scientifically literate as measured by factual knowledge. And that's even controlling for education, religion, and economics. It's actually one of the mysteries in this literature is that people have not been able to completely pin down exactly what the mechanism is for this lower confidence and literacy in scientific information. But it's a very well-established finding, again, even controlling for these other possible covariates. Another thing is that racial and ethnic minorities seem to have less access to medical professionals and could be more difficult to reach with health-related information. And then finally, misinformation campaigns have been known to deliberately target minority communities. And in particular, the anti-vaccine movement has done this, and there are examples of the anti-vaccine movement deliberately targeting minority communities. So all of that information from that literature would lead one to suspect that all else constant, relative to whites, minorities may be more likely to be misinformed due to the aforementioned reasons. The next group level correlate that we might consider is religiosity. And when it comes to religiosity, people who are extremely religious tend to be less scientifically literate and less deferential to scientists. They also tend to engage in more intuitive thinking versus analytical thinking that privileges faith over systematic empirical observation that defines science. So that would lead us to suspect that as religiosity, and by religiosity, I don't mean particular denominations, but just more attending religious services more often and having more devotion. As that increases, we would expect people to become more misinformed. So the third group level correlate, which is a little bit more complicated to discuss, is partisanship. The politicization of science over the past quarter century makes partisan group identity quite relevant. And as we see in studies of trust in science, we see an increasing split over the last 30 or 40 years where conservatives have become less trusting of science and liberals have become either more trusting or have a flat trend. But I'm going to focus here on partisan identity. And let me be very clear what I mean by partisan identity. That's the strength with which one holds their party, the strength with which one identifies with their parties. So in other words, the extent to which one thinks about their party in terms of we rather than they. And the idea here is that when one has such a strong group identity, a primary motivation psychologically becomes to distinguish oneself from the other group, from the other party. And so the impact of a partisan social identity depends on the nature of the misinformation in which party it sides with. That is, if there's misinformation if you're a Democrat and there's misinformation that's correlated with the Democratic side and you have a strong partisan social identity, you're going to be more likely to believe that misinformation out of this motivation to distinguish yourself and identify with the Democratic Party. If you're a very strong Republican on the flip side and there's misinformation on the Republican side, you're going to be more likely to accept that misinformation, again, in order to distinguish yourself. So holding the partisan slant of the information constant, which I'll relax in a moment, but holding that constant, we would expect those with stronger partisan identities to be more likely to be misinformed. Of course, we should not hold that entirely constant, given that there is asymmetric partisanship. And in particular, in the case of COVID-19, as is well known, Republican elites have been much more amenable to spreading misinformation and contradicting, if not directly ridiculing, scientific advice. And I assume most everybody listening in has been aware of the statements being made, not only by Trump, but also many other Republicans at different levels of office and standing. And so that would lead us to say, compared to Democrats, Republicans will tend to hold more misperceptions about COVID-19, which would lead to a caveat, a moderated relationship, such that the aforementioned relationship that I just mentioned in hypothesis 3 between partisan social identity and misinformation will be stronger amongst Republicans than Democrats, although it's constant. Again, simply due to the fact that there is more misinformation being endorsed by Republican elites in the information ecology. Okay, so the other correlates that we're going to consider in the study, which is not an exhaustive set, but a fairly large set of things, but not crucial group dynamics, but things that we look at, include major depressive symptoms, which I'll talk about because we find some interesting things on that. Exposure to Fox News, which is well known for passing on a good amount of misinformation about COVID-19. Number of COVID-19 cases in an individual's county, whether one had COVID-19, being at risk health-wise to COVID-19, gender, age, education, if you live in a rural setting, the amount of general COVID misinformation one has, the amount to which one discusses COVID-19, other network exposure such as CNN, MSNBC, exposure to Trump briefings, and exposure to social media. So those are other things that we're going to look at. But again, not our focus, given our focus is on group level factors. So those are the hypotheses that we want to explore. Now let me turn to the data that we put forth to explore these hypotheses. The data, again, as I mentioned, comes from this COVID states project, which I mentioned before. And we used the data from one of the data collections, which was from May 16th to June 1st. And we use this vendor called Pure Spectrum, and it's not a probability vendor because, again, given the motivations of our project, we're trying to get very large samples by state. I don't exploit that aspect of the data in this presentation. In this presentation, we're looking at the national level. And so we weighted the data to represent the country on key demographics using the census benchmarks. And so the sample size is 18,000, a little bit over 18,000 individuals. So on the survey, we had 2 misinformation batteries. The first was whether a series of 7 statements about COVID-19 were inaccurate or accurate. So these are just factual statements, and we asked people to assess whether they think they're inaccurate or accurate. They also could say they were not sure or not. The second battery asked them to assess the effectiveness or ineffectiveness of 6 ways to prevent COVID-19. I should mention that each battery also included a smaller set of 3 correct information items. And what we did with that, and what I'll show you, is that we wanted to look at the correlations of these correct information bias to make sure that anything we find with regards to the misinformation does not reflect what's called an acquiescence bias. That is just the likelihood to agree with something being correct or not. So we might see, for example, that more religious people are more likely to endorse misinformation items, but if they're more likely to also endorse more correct information items, that would be just an acquiescence bias insofar as they're just saying everything is true. So we included these correct items to rule out that possibility in looking at misinformation. So overall, we have 13 incorrect statements we asked people about. We asked them if these statements were correct or incorrect, or effective or ineffective, and 6 correct statements. Okay, so here's the list of statements. I won't go through all of them. We chose the statements largely based on the World Health Organization website at the time of the survey, or just before the survey. And they have a very nice feature on the World Health Organization website that's called the Mythbusters, which lists a lot of myths that have been circulating. And so these are prevalent rumors that are being spread that are misinformation rumors, and that's where we got the primary data. But then we also looked at the time kind of at circulating stories right before a survey collection in the US and things that were going on. And so you can see the different sources of the information we use. So for example, some of the misinformation, factual items that were incorrect, only people older than 60 are at risk for COVID, which is, only people, they might be more at risk, but they're not the only people at risk. Another misinformation item was mosquito bites can transmit the coronavirus. Both of those were from the World Health Organization website. One that we got that was publicized by the Pew Organization, but obviously also very prominent in political rhetoric since Trump endorsed this perspective, was that the coronavirus was created as a weapon in a Chinese lab. Others, holding your breath for 10 seconds without coughing will show you don't have coronavirus. Martial law, humans originally got coronavirus by eating bats, and there's a link to using 5G wireless, which was a prevalent myth at the time. In terms of effective, those were the facts. These are the effective or ineffective. These are all ineffective approaches to battling the COVID-19. Is the idea that you could take a flu vaccine, a pneumonia vaccine, use hot air hand dryer, taking antibiotics, rinsing your nose with saline, applying sesame oil to your skin, and the idea that there had been a national emergency declared. In terms of correct statements, so again, I mentioned that we had a set of correct statements. Those were the coronavirus has led to a spike in unemployment. There's currently no vaccine. At the time of the survey, there was no vaccine that was being distributed or authorized. Wearing a face mask is useful. Staying away from other people is useful, and washing your hands. Those were the correct statements that we were looking at. So when we look at the distribution, I'll show you a nicer graph of this, so you don't have to focus too much of your attention on this. These are just the percent of people who endorse each of these items as being correct, even though they weren't correct for the top half of the panel. So for example, 20% of people endorse the idea that only people older than 60 are at risk of coronavirus. Obviously, a fair number of those may have misinterpreted that statement, saying that they're more at risk rather than only being at risk. But still 20% read that incorrectly or had an incorrect belief. 19% said the coronavirus was created as a weapon in a Chinese lab. 17% said that originally got it from eating bats. When we look at the correct information, you can see those percentages are dramatically higher. 66% correctly said that there was a national emergency declared. I think there was an error on the prior slide. It should have said martial law rather than a national emergency as an incorrect information. The coronavirus has led to unemployment. 88% knew that was accurate, and there's currently no vaccine, 80%. We see similar percentage. I won't go through these individuals, but on the effective or ineffective approach to dealing with COVID-19, we see similar low percentages for the misinformation and fairly high percentages for the correct information. So when we look at just the number of misperceptions that people held, the distribution of that, this is just a histogram of the percentage of people who held the number of up to possible 13 misperceptions. So remember, there were 13 possible statements that people could have endorsed as correct that were actually incorrect. And what we see is that nobody endorsed more than 9 of them. So the highest number was 8. We saw 34% of the individuals endorse none of them. 28% endorsed just 1. So what you're seeing is that in the population of the survey respondents, we're not seeing it's a fairly skewed distribution in terms of people not having a lot of misperceptions. So that's an interesting finding in and of itself, insofar as we're all very concerned about misperceptions, but these may not be as prevalent as a lot of us believe. That said, there is a huge caveat because even holding one or two misperceptions can lead to fairly dire situations if you follow up on that misperception in your belief systems, either in your own healthcare or attributions you make or policy beliefs that you see in the form. On the flip side, if we look at the distribution of correct beliefs, we see 41% endorsed all 6 of the correct items as correct, 35 did 5 out of the 6, and we see only 1% got 0 out of the 6 correct. So we see very different distributions on correct versus incorrect beliefs. So for our analyses, what we're going to do is we're going to count for each individual the number of misinformation or the number of correct information in separate models that items that are responded endorsed as true or accurate. And so we're putting, as I mentioned before briefly, people could say they were not sure. We're not going to count those as a positive response. They had to actually endorse the statement as true or being an effective antidote to be counted as a misinformation or a correct information answer. Then we regress these counts using a Poisson regression on the explanatory variables. And what I'm going to show you is not the regression tables, but I'll show you the predicted number of misinformation, correct information items by the relevant groups that I talked about before with their 95% confidence intervals. So for the main independent variables, for the minority group status, we simply ask for self-report racial ethnic identification. And so we were going to look at African Americans, Hispanic, and Asian Americans, and you can see the distribution of those groups in the sample, 12, 15, and 6%. For religiosity, we use an item that's common on the General Social Survey, a 6-point scale measuring how often you attended religious services. One thing we were a little nervous about this item is that we did not say before COVID-19 because we weren't sure if we should do that or not, but we explored this item quite carefully, and actually this item distribution looked very much the same as it looked before COVID-19, looking at the General Social Survey. So people were interpreting this both in terms of going to virtual services, which seemed to kind of go kind of without a break seamlessly during COVID-19. And then for partisanship, we ask a standard 7-point partisan affiliation scale, ranging from strong Democrat to strong Republican, with higher scores being strong Republican. And for partisan social identity, which I said was a key variable, we used a 4-item 5-point scale, kind of along the lines of what I mentioned before. Items like, when you think about your party, do you think in terms of we or they? How important is the party to you personally? And we aggregated those items, which aggregated quite nicely into a score where higher scores had higher partisan social identity. We ask a bunch of other independent variables, which I'll skim through very briefly. For major depressive systems, we asked the average score on a 4-point scale of the PHQ-9 item, which is a fairly standardized item to measure depressive symptoms. We asked just a dichotomous variable at Fox News, MSNBC. We got data from the New York Times on number of COVID cases in an individual county, and so on and so forth. We don't need to go through these in great detail because I'm not going to talk about their results very carefully. Okay, so let me show you the results, and I'll talk you through this table. So this is the predicted number of misperceptions. So remember, we were just looking at how many misperceptions out of a potential 13 misperceptions do individuals holding all other variables at their mean. And what we see for the first hypothesis about minority groups is that we see, for example, that if for people who were self-reported whites, they on average held 1.3 misperceptions. We see for the minorities, they were statistically significantly holding more misperceptions. So African Americans held 1.9 on average, Hispanics 1.7, and Asian Americans 1.6. And while again, to emphasize, these are not a high number of misperceptions, and these are not vast differences, given the impact that a single misperception could potentially has, we think they are quite meaningful differences in terms of substance and potential consequence. As I say at the bottom of the slide, the disparity of tending towards 2 is meaningful, given half the sample is at 0 or 1. We also see in terms of racial minorities, when we look at individual items, there's not a particular item that's driving these findings. So there wasn't one, it wasn't kind of like the Chinese eating bats was not driving these findings, or any other particular item was not really at work, which will, when we get to partisanship, we will talk about how there were particular items that were driving those findings. Moving to religiosity, this was just showing, comparing the two groups, one at the bottom end of the scale, and one not at the highest category, but the second highest category, people who never attend religious services to those who attend once a week, and looking at those. And then if we looked at other categories, the differences would monotonically be smaller, but we see a statistically significant result insofar as those with more religiosity lead on average 1.7 misperceptions versus 1.3 for those with the lowest religiosity. And then when we turn to partisan social identity, the first thing circled there are Democrats. So the first circle is Democrats with the minimum partisan identity had 1.1 misperceptions, whereas those with the highest partisan identity had 1.6 misperceptions. And when we look at Republicans, those with the lowest partisan social identity had 1.0, while those with the highest partisan social identity had 2.1. So that's consistent with the hypothesis for both parties. Stronger partisan social identity led to a significant increase in misinformation. And here, unlike, I didn't mention this, but for religiosity, they weren't particular items of note either. But here, particular items did stand out. For Democrats, there was a particular belief in susceptibility to the belief in ineffective antidotes, insofar as the flu and pneumonia vaccines would be an effective way to battle COVID-19. We really aren't sure exactly where those beliefs came from because they weren't particularly prevalent in the elite rhetoric information ecology, but those were things that we found in the data. On the other hand, for Republicans, not surprisingly, given the rhetoric that was going on, those were driven a lot by a very strong belief, especially those with strong Republican partisan social identity, a belief that it was a weapon created in a Chinese lab, which, as I mentioned, was endorsed by President Trump, or the usefulness of taking antibiotics, again, which was something that Trump strongly endorsed, as people may remember. And so in that case, there were particular items. And again, coming back to that fourth auxiliary hypothesis, we do see Republicans, this asymmetric partisan effect, that Republicans with strong social identity were significantly more likely to have a higher number of misbeliefs than Democrats with misperceptions. So if we look at some of the other variables, not the focus variables, we see that most of those did not really have a particular effect. There are two things that did stand out as notable. One was depressive symptoms. So people with more depressive symptoms were more likely to hold misperceptions, which is an interesting dynamic that we were trying to think through. Another, not surprisingly, quite a large difference for those who reported viewing Fox News regularly. They were significantly more likely to have misperceptions. But all of the other things did not have an effect, which is interesting. For example, if you look at the quartile of the number of COVID-19 cases in the county in which you live, that had no effect. And so it wasn't like being surrounded by more COVID-19 cases didn't lead you to have less misinformation, which was one thing that we thought could have been possible. So if we look at the correct information, remember I talked about this possibility of the acquiescence bias. And so we wanted to run the same exact models, but again, instead of the 13 count misperception items, we used the 6 count correct perception items to make sure that the results we found were not just from this bias of everybody of groups saying that things were simply correct. And we find that, in fact, misinformation results did not stem from this acquiescence bias. The misinformed groups, if anything, they had hold fewer correct beliefs. So, for example, you see for minorities, African Americans held slightly fewer correct beliefs than white Americans. And otherwise, you see the groups held pretty much the same beliefs. And if you look down at religiosity or partisan social identity, there's no substantial differences in terms of holding correct beliefs. So the results I showed you on misperception did not seem to be stemming from anything along the lines of an acquiescence bias. And if we look at other variables on correct information, there's really nothing going on. We were unable to identify particular variables that were leading people to hold more correct information. But part of that is that we were hitting a ceiling insofar as, if you remember the distributions that I showed, much of the sample was 41% of the sample had all of the correct information. So there was not a ton of variance for us to explain there. So to summarize this part of the talk, and then I do think I have a little time to talk about some of the Twitter results. Misinformation about science can undermine efforts for a healthy society. Even small bits of misinformation can have deleterious effects. We find that minorities, religious individuals, strong partisans, particularly Republicans, are more susceptible to misinformation about COVID-19. We need more work to identify mechanisms. So one of the glaring gaps in the paper of what we presented is I did put forth hypotheses that might lead us to suggest or imagine the dynamics that we found, and we had those going in. But a lot of the work which we drew on do not really get at the specific mechanisms that's going on work, and particularly with racial minorities. What is the mechanism going on? There's all this large literature showing these gaps in scientific literacy and trust you can understand, but we don't have a full understanding of what's underlying those findings. So our findings, we think, provide guidance about which communities would benefit from better messaging, and clearly public health policymakers moving forward should account for factors like race and ethnicity, religiosity, and partisan identity when they're thinking about minimizing damages from misinformation. And particularly, we didn't talk about this in the talk, but one thing we're doing now in the project is looking at misinformation about vaccines. And we're finding some similar dynamics. And we're then exploring some kind of the messaging processes that might lead to kind of counter misinformation about vaccines and build trust in the vaccines. But we are finding, again, some differentiations by race and ethnicity, religiosity, and partisan identity when it comes from vaccines, but those data are not fully analyzed yet. So if you want more information about the project, there's the website again. But given I think I have 5 or 10 minutes left, this is another part of the COVID States project on misinformation, but it's not related to looking at these group level correlates. So let me just briefly talk about that because I think they're quite interesting, and there's a quite puzzling dynamic that I'd be interested in hearing anybody's thoughts about if they have them in terms of what we find. So this part of the project is looking at fake COVID-19 news on Twitter. And as everybody knows, and as I said, much of the work on misinformation and on COVID-19 is focused on social media, is that social media can act as a conduit for fake news websites. And when I say fake news, I'm going to define that as is fairly standard in the literature. It's information that mirrors legitimate news in form, but lacks the news media's editorial norms and processes for ensuring the accuracy and credibility of the information. And so what we did is between January 1st and September 30th, 2020, we got a bunch of tweets from a sample of registered voters in America. We matched those to demographic information such as age, race, gender, and political party affiliation to try to get somewhat of a representative sample of people on Twitter. And so we got 1.6 million accounts. These are all in the public domain, and so we don't need to get, the IRB serves these types of projects as exempt because these are public observational data that are publicly accessible. And so we got all of these accounts. And then what we did is we changed only those that had COVID-19 tweets by filtering the number of the accounts on a broad list of 974 multilingual words and phrases that had hashtags related to COVID-19, including things like shutdown, policy restrictions, social distancing, and things like that. And so the total number of COVID-19 tweets we have is a little bit over 29 million. Of the 29 million COVID-19 tweets in our panel, about 7 million contained actually a link to a URL. And so we're going to look at those URLs to see if those are from fake news websites. So that's the particular sample that we're going to look at here. And what we see in terms of showing, this is just sharing COVID-19 websites, not based on fake or not fake. And what we see here is just some interesting dynamics. And this is just the per capita of shared COVID-19 URLs out of all shared URLs. We found older registered voters share the most URLs per capita on the topic of COVID-19, generally speaking, which is perhaps not surprising given the vulnerability of older individuals to COVID-19. So they might be discussing this a little bit on social media. We also see Democrats tweeting more about COVID-19 than Republicans, which again might not be surprising given that Democrats took the COVID-19 much more seriously over the course of this time period. Turning to the fake news aspect of this, what we did is, as I mentioned, we collected the COVID-19 URLs shared by our panels. And then what we did is we classified them as originating from a web domain that was either fake, not fake, or unknown. And we did this using a system from an article that was published in Science. And one of the collaborators on the project, David Lazier from Northwestern University, is part of this, that was part of that article and kind of an expert in identifying fake news domains. And so these are domains that are a set of websites taken from a pre-existing list of fake news sources. And so very importantly, when we're doing this analysis, we're looking at tweets that had URLs from a domain that had been determined to be a fake news domain. We are not looking at the content of the tweet. So it's entirely possible, although we don't think this happens very often, that somebody was tweeting a URL and saying, avoid this URL, it's a fake news website. That's not very common as far as we can tell, but it is possible from the way we were looking at the data. So that's just, again, the bullet point there, based on domain and not content of the tweet. We did in these data correct for repeat shares. That is, if people share the same URL over and over again, we didn't count that as multiple shares. And so what we found was the vast majority of shared URLs from COVID-19 tweets are either from known and reputable domains, 60%, or from domains that we didn't know their quality. But we have no reason to think that they were of questionable quality per se. These were domains that we just hadn't classified from the system that we had. So the percentage of URLs from domains that publish fake news comprise only 1.1% of the URLs from COVID-19 tweets. So similar to the misperceptions, when we look at the aggregate level, we're not seeing a huge amount of misinformation being shared via Twitter. But again, even 1.1% of shared information can have pretty deleterious consequences. So it's not something to take quite seriously. And again, I should say, although we didn't analyze this 38.9%, well, we think the bulk of it was probably from credible URLs. We don't know. So we tried to do some estimation of this, and that we basically came up with maybe rising from 1.1% to somewhere in the neighborhood of 2% when we tried to do that exercise, but we're not sure about the quality of that exercise at this point. So when we just look at this broken down by who's sharing this fake news on Twitter's, very interesting, we find that older voters share the most URLs from fake news domains, and this is correcting for the fact that they're sharing more COVID information in general. So this is even holding that constant. Older voters are more likely to share URLs from fake news domains, and that's true across political orientations. We also show, you can see in the red bars, that Republicans are more likely to share fake news URLs than Democrats or independents, as you can see in the red lines there, which perhaps is not that surprising. So here's the puzzle. So all of that is actually consistent with prior work on political misinformation, that older conservative voters are more likely to share misinformation. But here's the puzzle. When we looked at misperception, I didn't show you this from the data that I looked at earlier. It was in the model, but I didn't show you results from this because it wasn't our focus. But what we see is that when we look at belief in misinformation by age, what we see here is that we see it's a little bit of a, this is probably not the best way to graph the information, but we look by age. So this is the number of misinformation items that people endorse. If you look at the bottom of the graph and you look at all three bars, even though you see the red bars are a little bit higher, as I showed you before, Republicans are more likely to have misperceptions. Older voters, those over 65, have much fewer misperceptions than the younger voters, 18 to 29, or even the 30 to 49, or even the 50 to 64. So this is a bit of a puzzle, right, in our data, because we found that older voters were more likely to be sharing URLs from fake domains, but they're less likely to have holding misperceptions in our survey data. So as I just said, then in the survey data, younger people are more likely to believe COVID-19 misinformation when compared to older people. And so that the findings of this kind of paradox suggest that older people share misinformation, but they actually believe less misinformation. And so that's a paradox of mismatched belief and sharing patterns with respect to age. It may indicate that Twitter users have different belief patterns than the general population. That is, the survey data was from a general population sample, whereas the Twitter data are from people on Twitter. So it might be that people on Twitter just operate differently than the general population, or it may point to an age-related mismatch between what people believe and what they're likely to share. And that's something that we're looking to really unpack going forward. So it's an interesting data paradox that I thought I would add, while again, not speaking directly to the group level factors that was the focus of the presentation. It is an interesting dynamic going on social media. And as an aside, as I didn't emphasize this, but we did see again a clear partisan consistency both in belief in misinformation and the sharing of misinformation. And then for those of you who are interested, as in the last slide, I don't know how many of you are even familiar with these web domains, but the most prevalent, this is not a domain that I had known about before, but there was one particular URL that was shared with overwhelming frequency called the Gateway Pundit, which is a fake news domain, and that really overshadowed every other fake news domain that we looked at. And for those of you who have heard of these, that might be of interest to you. So I thought I would put that up compared to some of the other fake domains. So again, this is kind of an aside, something else we're doing with misinformation on the project. And so the two things that I presented today are, one, thinking about the group level dynamics and the importance of trying to address those and ameliorate those group differences. And then the idea of kind of this weird age level dynamic going on in belief about misinformation and sharing misinformation. So I think I'll wind up with that, and I welcome your questions, and thanks for your patience through a fairly long presentation.
Jamie, thank you very much. Wow, what a timely topic. I learned a lot today. If anyone has a question, they can put it in the Q&A section. We have a few questions in there. One of them popped up very early, and I think you addressed it, but maybe you could just comment on it. Are you really positing that even for PhD or MD level educators, quote, controlling for education, minorities are less scientifically literate?
No, I mean, that's actually a really great question. So in our models, we're controlling for education, so holding education constant at its average. The minorities is still having an effect, but that's different than the question I think you're asking is that if we looked within the group of highly educated individuals, would we still find a minority effect? It's a really great question. It is not something that we looked at. And one of the great advantages, I'm sorry, I'm just writing this down because it's a really great comment, because one of the great advantages of our data is that we have such a large data set that one of the real drawbacks of prior work on scientific belief in this domain is that there's typically not large samples of minorities, but we actually probably have enough data to address that question, to look in to highly educated minorities and kind of see if a minority perspective is going on, if there's any differences within that highly educated segment. And I would suspect not, but it's a great question. It's something that I certainly look forward to exploring.
All right, great answer. Hey, the second one, how did you decide to determine high versus low religiosity by using the question of how frequently you attend a religious service? What other questions did you consider to gauge religiosity?
Yeah, that's a really great question. There are a lot of ways to measure religiosity, and we part of this. So in the ideal environment, we would have gauged this not only with that question, but also the other two things that we would have added were a religious devotion and kind of belief in the literal word of the Bible. Those are the types of questions that would be even more stronger composite of religiosity. And then the other thing that we would have liked to do in an ideal setting was look at denominational domains. So look at the differences between different religious denominations to see if there's anything going on, because there is work on religiosity and scientific beliefs that looks at both of those things. So to be perfectly honest, we are trying to do so much in these surveys. We're trying to capture so many different dynamics that sometimes that we use what we think is the single best indicator to capture a concept, which we thought the frequency of attendance was the best at capturing religiosity in a short question that could be answered. But we are motivated now by these findings that we found this dynamic to try to, at least in one of our surveys, because we are collecting data so frequently, to put on a more developed composite of a measure of religiosity, to look at devotion and kind of, again, the literal world of God in the Bible, and look at different denominations, which we did not explore. So we took that particular item, as I mentioned, because it's a common item on the General Social Survey, which is the kind of the most prominent public use data set in sociology. So that's why we took that particular question. But I think your larger point of it would be interesting to look at better questions and more questions is very well taken as well.
Another question. Just because someone says something is good at preventing the spread of COVID does not necessarily mean that the same person is engaging in preventative actions. For example, someone can say they know wearing masks help stop the spread of COVID, but enforcing masks goes against their rights. Do you think this is captured at all in your findings? And do these people need a different kind of targeted message?
Yeah, that's a wonderful question. Yeah, yes. So you're really Nicolette, who's a great PhD student in political science. You're getting at a disconnect that's a historical disconnect in psychology between attitudes and behavior, and behavior does not always follow from attitude. And indeed, we do on these surveys not only ask about if you think this is effective or not, but we very carefully, and one of the major things we do on these surveys is ask people to self-report the behaviors that they are engaging in and the policies they support. And indeed, as you're suggesting, there's not a one-to-one correspondence between saying, for example, that wearing a mask is effective and people wearing masks. It's moderated, as you would suspect, bipartisanship moderates that relationship. And generally speaking, the stronger you believe something is effective, the more likely you are to engage in that behavior. Unfortunately, the way that we measure these, we didn't measure the strength with which you believe in the effectiveness, but that would be something that we would do if we want to really uncover the link between attitudes and behaviors. But yeah, the cautionary note is very well taken, that we were looking at beliefs and not necessarily behavior. And we definitely did find that one does not lead to an automatic to the other. There were a fair number of people in the data, particularly on mask wearing, as you suggested, which was the easiest to look at, that said, yes, wearing masks are effective, but they also reported not regularly wearing masks.
The last question we have in the box from Mark Huffman: how might the degree of political affiliation be moderated in the current polarized political climate? very loaded question here.
Yeah. So this is a great question. And so I'm gonna kind of move on to some other work that I've been doing around polarization more directly outside of this data. And so in other work, we've looked more directly at polarization, and particularly in this work, we've been looking at levels of what's called affective polarization, which means the extent to which you hold animus towards the other party. And what we were trying to see is if people who feel more polarized, that is, they have more dislike for the other party and more like for their own party, reacted, if that explains some of the partisan differential in COVID-19 behaviors. And this was a very interesting design insofar as that we had measures of polarization and the level at which people had partisan affective polarization. That is how much they disliked the other party and liked their party. We had a survey which measured that pre-COVID. So we had a panel of respondents who reported that before COVID, the onset of COVID, and we were able to go back to those individuals using their data of their polarization levels before COVID. So we knew that those levels were not being driven by what was going on during COVID, and see if those who were more polarized were more likely to follow what their parties were endorsing during COVID-19. And we did find a very strong relationship such that Democrats who were very highly effectively polarized were more likely to engage in protective behaviors. They were more likely to endorse restrictive policies. They were more likely to express greater worry about COVID-19, whereas more polarized Republicans, those who prior to COVID expressed greater animus towards Democrats and greater love of Republicans, were less likely to engage in COVID-19 behavior, protective behaviors, less likely to endorse restrictive policies, express less worry about that. But so that was a very long-winded answer to a great question. That I think that the polarized climate had a very direct and palatable role in the response to COVID-19, and the divide that we saw amongst elites trickled down into the populace and really drove the response to COVID-19. With the one caveat, what we found in the data was that those who were living in areas, at least in the early onset of the disease, where it was particularly high number of cases, so very threat-oriented areas, in those cases, the impact of polarization really disappeared. So Republicans, for example, who were living in New York, for example, during the early stages of COVID-19, partisanship kind of disappeared as a determinant of their behavior because it was such an imminent threat that they were engaging. Republicans, for example, were engaging in more COVID-safe behaviors. And Democrats who were living in very high areas, even those who were low on the polarization, but Democrats were still then engaging in these behaviors. So it was moderated by real world conditions at some level. And so polarization played a very big role according to those data, consistent with what I showed in the misinformation data, but moderated by some of the real world conditions. And if you're interested in that paper, shoot me an email and I can send along the paper, or it's also posted at the Institute for Policy Research website. So sorry, that was a very long-winded answer, but you tapped into another project that I couldn't resist talking about.
Thanks, Jamie. And this is Kate Klein, Associate Director of the Institute for Global Health. I'm jumping in here for Dr. Murphy, who had to pop off to another meeting, as we all do. It looks like we have one more question, which is an interesting one. It says, your study makes the assumption that COVID did not come from a Chinese lab. Suppose your assumption is wrong, and how would that skew the data and conclusions? And maybe that you could answer that more generally about, all of the news that is classified as fake news, and what if the answer changes?
Yeah. So that's a superb question because it's really getting at the essence of how do you define misinformation and misperceptions. And in the literature, there's kind of two standards that people use. There's a more stringent standard, which would be something that is definitively false. So that would be a piece of information which we know is contradicted by information that we have. Something where we say that climate change, that if you said something along the lines of there is no evidence that humans are affecting climate change, we have definitive scientific information that is contradictory to that. So that would be a definitively false statement. Another criteria, which is a lower level of criteria for misinformation, is that a claim that is unsubstantiated. That is that there is no evidence consistent with the claim. And so in terms of the way we were classifying misinformation and how the WHO website, which we drew on a lot, was classifying misinformation, is that we were using that lower standards unsubstantiated information. That is claims that had no evidence to back them up, but they still could be true in the long run. Perhaps we will find evidence eventually that this was actually a true statement. So in that sense, it's a great question. If our assumption is wrong, it would skew the data because we would have to then go through each of those statements and reevaluate them and kind of use a different, we could go through them. I can't do this off the top of my head right now and see which ones, if any of them met the definitively false standard, which was not the standard we were using. But if we use that standard, we could get different findings. And if some of the unsubstantiated data proves to be substantiated later on, that could also change our findings. So again, that's a really important question. Whenever you see, and I'm really glad that you asked that, because I think it was incumbent upon me, which I didn't do, but whenever you're seeing people talk about misinformation and misperception studies, I think it's a really important question to ask if you're using the definitively false standard or the unsubstantiated standard, because they are two different ways to think about misinformation and misperceptions. And I should have made that clear in terms of how we were classifying the statements that we use. So I appreciate the question very much.
Well, thank you so much, Jamie. I think that is about all the time we have for questions. So first of all, I would like to thank you for taking the time to share
Yeah, thank you.
your insight and expertise for us today. I think this is, as Dr. Murphy said, really one of our most timely talks. And we also want to thank the audience for joining us and for submitting your thoughtful questions. And we hope that you'll join us in February. We have our next installment of our First Friday webinar series, and we'll be joined by Dr. Igor Koralnik here at Northwestern in the Department of Neurology for discussion on neuro-COVID research and the threat of COVID-19 to the nervous system. So again, thank you all for joining us today. For those of you that registered and are attending, you'll also receive the recording of the webinar. So that will be shared by email shortly. So this concludes today's webinar. Thank you so much and have a great rest of your day.
Thank you.